Hi, I'm Stephanie Lind, and welcome to this production by Brilliant Birth Academy on transitioning oiled labor spaces to newborn safe birth spaces. This course is going to teach you how to help protect the newborn from maternal oil use and is not the full instructions for professional use, but just safety information if there's a mother under your care who is using essential oils. This course is really all about that incredible time after birth and the how to protect the physiological transition of the newborn during that time when the mother and infant are experiencing a tremendous amount of emotional, physiological, relational, neurological activity, all within this transcendent experience of bliss and connectedness. We're going to talk about how to cleanse the labor area of aromatic constituents so that parents can safely welcome their baby into a room that's filled with the smells of amniotic fluid and the mother and not essential oils. So, we're also going to be talking about, like I said, the physiological transition of the baby as they adapt to life outside of the womb. And let's dive in. I love training birth professionals because I feel like the information that I invest into you is just used to serve so many families. And it's such a joy to be able to do this. Now, ideally, if you're working with a mom and she's expressed that she is going to be using plant based solutions to make her more comfortable in birth and grounded and inspired and focused and just all the things that they can do, you really want to have that conversation with her early. And ideally, you want to have all constituents cleared before the signs that delivery is imminent. So she should really come into agreement, ideally, that before the end of the second stage of labor, oils have been cleansed. And this is how you know, in case you're a doula and maybe need a refresher. If you're a midwife, this will certainly be review. How do you know that delivery is imminent? This is really useful because I feel like the number one question doulas are always asked is the baby coming yet? Not that you can answer that question, but here are some signs. You're going to see an increase in bloody show or discharge. Often the membranes will rupture if they haven't already. The mother may experience the desire to bear down. Tonally, the mother may grunt during contractions or at the end of exhales. Sometimes she feels a pressure in the rectum, similar and oftentimes mistaken for a desire to have a bowel movement, and the perineum will flatten and then bulge. This completes the second stage of labor. Now, let's look at the first moments after birth from a hormonal perspective, starting with adrenaline, because in the moments just before and after the birth, both the mother and child have a highly complex hormonal release that really takes them to the heights of the human experience of love and connection. It is an experience that does not last more than a few moments and will never be repeated. These moments profoundly affect the newborn's neuropsychology, their development, and set the foundation for their lifelong capacity to trust, to love, to make connections with other people, to handle difficulty and discomfort. We're now doing studies on the stress levels of the maternal side of the family back 2 and 3 generations and how that may affect adrenaline release in the newborn during the last stages of contractions because this adrenaline actually protects their brain from possible lack of oxygen during the last part of delivery, and it also ensures that the baby is alert for their welcome into the world. You'll notice a lot of babies have dilated pupils and they'll only open their eyes if the lights are dim in the room. So, this release of noradrenaline, which is a part of the adrenaline family, is really important to newborn outcomes, and it is protected in part by quite a few things, but a lot of it is very much based on the stress and well-being of the mother. Sarah Dr. Buckley is a well published doctor, and she talks about this time as a powerful imprinting in the relationship between mother and baby. She thinks it's important for them just to be quiet and fully present as they discover the sacred origins of our capacity to love. Now, the desire to love and care for the newborn is experienced that the mom will really draw inspiration and strength from these moments for the rest of her life, but certainly during the next few months of sleepless nights and long days. This is the beginning of an attached relationship. It is the first connection that a child makes, first with their mother and then with both of their biological parents. And when that doesn't happen, we have 50 years of social studies data that indicates that special supports are needed when there is that primal loss of a biological parent. And some things that you can do to help the mother be comfortable and to create this deep bond, which again is really the blueprint for all future attempts at connection that newborn will make. We now know through neurogenesis and how we can use our mind to restructure our brain that recreating means and ways and patterns of connection is possible. But it's so wonderful, and that's why I love investing in birth workers. It's so wonderful when you just do things in a way that is an evidence-based healthy practice the first time, so that you don't have to go and do all of the years of rehabilitation, and children are able to be born into a world that feels like love, joy, peace, and connection right from the beginning. One thing that is often overlooked is that a warm room temperature of at least 74 degrees is really important. That will enable the mother to transition hormonally at the important time in order to transition from adrenaline to increased oxytocin production. When she begins to come down from that adrenaline high, a cold temperature or a stressful situation could counter oxytocin's effort to contract the uterus, and maybe why there is hemorrhage uh, in some cases. So, the newborn's physiological adaptations for life outside of the womb is significant. Their lungs, digestive tract, liver, kidney filtration systems, these all begin to operate for the first time. The placenta had previously done their jobs, and the additional blood from the placenta and cord provide the blood volume needed to jumpstart these systems. So, as these are initiated, ideally the infant is held close and warm against the mother's skin and is able to have these new tasks continue to be synchronized by the mother's rhythm as they direct their first attempts at regulation in life outside of the womb. Perhaps the most critical of the physiological tasks is the diversion of the baby's blood out of the umbilical cord and placenta and into the pulmonary system. This is something that's ideally done in 3 minutes, and after that, the mother can lift the baby to her chest. This natural process of transfusion enables the initiation of over 10 vital physiological processes in the infant, and it's ideal when that is not hindered by an early clamping of the cord. During labor, the baby's lungs are compressed by the pelvic floor, which expresses fluid out of their lungs, and they transition to independent breathing. Mammals are not naturally intended to be born underwater. A baby will breathe on the perineum, so it's important that the baby is able to get forceful air into their lungs so that the baby can transition to their job of breathing air. Oh, I didn't say this at the beginning. So I would like to dedicate this course to my son, Matt, who I held at my chest, and he had such a negative reaction to the essential oils that I had smeared all over my chest. So take my story of warning, know better and do better. You'll notice in some of these, he had grunting during exhales, flared nostrils, was arching his back and his head away from the essential oils. I simply didn't know that, it wasn't ideal for him to be deeply breathing in an essential oil that specifically had peppermint in it, which is very disruptive to this physiological process. And gosh, I know better now. So you want to make sure that the baby doesn't have I would just like you to know these are signs of compromised breath. The reflex to breathe can be affected by essential oil constituents, and the lungs can be affected specifically by peppermint. The constituent menthol is very affecting to newborns. So with essential oils, when you have them on the skin, you might have a 5% uptake of the oils into the bloodstream. Depending on their molecular weight, you're going to have a bioavailability that sets in after about 4 to 12 minutes. However, when you do an aromatic inhalation of essential oils, those constituents can go directly through the olfactory nerve into the brain past the blood-brain barrier, and they can even go right past the frontal cortex, so you're not even aware that you're being affected, while they directly affect the limbic system, which of course is tied in to your breathing and your psychology and your heart rate, and goes to every single cell in your body, which has intelligent surface cell receptors. So we now have no contention around the fact that it is medically accurate to say that your right brain and your limbic system and your whole body is your subconscious. That's crazy, right? And that is directly affected by the chemical constituents of essential oils. So you absolutely don't want repressing, calming essential oils. And you also don't want stimulating essential oils unless you are like a NICU trained nurse slash aromatherapist. They are having amazing success with essential oils with newborns and critical conditions in the NICU wards right now. But if you're not trained at that level, we really want to support. We don't want to see compromised breathing at a birth. We want to see easy, wonderful breathing. These are 5 signs of a healthy, oxygenated newborn: color, tone, absence of meconium, breath, and heart rate. You'll recognize these as the Apgar score. And I just want to take just a second and tell you about one of my heroes. For a long time at Brilliant Birth Academy, we had a scholarship called the Virginia Apgar Scholarship. She was a person, her favorite thing that she said all the time is do what is right and do it now. When she graduated from Columbia in 1933, there were almost no strategies for newborn care that had been standardized. The prevailing attitude was they breathed when they came out or they didn't. Doctors would give them a slap on the bum, but if they didn't spontaneously start breathing, they wouldn't hand the child to the mother. They would tell her that her child had simply not survived birth, which oftentimes wasn't true. Oftentimes these infants would just be left on the tables to die when they could have survived. After being tired of arguing with male colleagues over individual cases and enduring endless accusations of feminine sentimentality, Virginia decided to do something about this, and so she created the first standardized criteria for evaluating newborns. And these included the scores that you're familiar now that test heart rate, respiration, muscle tone, color, and reflexes. After she tried it on over 1,000 newborns, she presented it at a conference and it caught on quickly. She had guessed that men would like scoring systems, and they did. And they began not only observing and assessing each baby, but actually getting competitive and seeing if, what they could do to raise the baby score. So they started doing it at 1 minute and then at 2 minutes. And doctors began to repeat this test. And more importantly, what started to happen is it created a culture where newborns who needed care started to get it. It spurred the development of newborn-sized recitation tools, which hadn't previously existed, infant heart rate monitors, which hadn't been developed, and neonatal intensive care units that had not existed. Thanks to all of these efforts, and the philosophy that came with them, the U.S. infant mortality dropped from 58 babies dead out of 1,000 to, in the 1930s, we were only losing 7 of our children per 1,000. And despite other innovations, the New England Journal of Medicine said just recently that the Apgar score remains as relevant for the prediction of neonatal survival today as it was nearly 50 years ago. And today, it's been said by people that every baby born around the world is looked at first through the eyes of Virginia Apgar. That's awesome, right? I mean, that's just really beautiful. So I share her story with you because she was one person who knew better and did better. And we're just starting to have evidence-based care for our physical bodies in birth. But I really want to challenge you, if you're listening to this, that there is so much room for development in the emotional, relational, and spiritual work, and of the importance. We now have so many years of data on what we need as humans, not to just live, but to thrive and to really come into a level of community and connectedness. There's not a lot of room in the data for dissension, and we need people to start doing things like Virginia Apgar did, where we're challenging people around us to care for more than just the physical needs, but for all of these other spectrums of needs that we have as humans. It's just something that I care so deeply about: children's rights, children's care, and really I think that she stands as an amazing historical example of how you really can change an entire system with a really simple idea. So maybe you have an idea that's going to bring a higher level of life and connectedness to our world. I hope that you do it. I hope that you share it. So, lastly, the baby is doing the work of being colonized by bacteria, which is why you wouldn't want to have any essential oils that are antibacterial, antiviral, antimicrobial. They're very effective. And then, lastly, after the birth, it is ideal for those adrenaline levels that got the mother and baby through the birth to be soothed. And oftentimes, I will ask people, what is the most comforting smell to the newborn? And they'll name the different chemical constituents. They'll guess lavender, clary sage, Roman chamomile. The most comforting smell to the baby is actually amniotic fluid. So that's ideal to keep their birth blankets near them and comfort them with those smells. So thanks for that very lengthy introduction, your attention for that. Now let's go to First Aid Masterclass. This is another free class that we offer at Brilliant Birth Academy. And this is important that people know this because a lot of moms using oils don't seek aromatic consultation or oversight. And it's just oftentimes because they have a worldview that they value natural plant-based medicine, but they don't really have a dependence on professional information. They have more of a focus on a lifestyle approach to wellness, and they view conventional medical care as a secondary resource which they seek out in emergency or severe illness. So that idea that they need someone to specifically tell them what to do, it's not going to pop into a lot of these mom heads to seek aromatherapy counsel. So anything that you can know if you're a midwife, a doula, or a nurse to help keep moms safe in their own oil use, or if you are serving at the level of actually using the oils in the birth, it's really important to know how to help keep moms safe. And the best thing that you can do in order for safety is really prevention. I just love Benjamin Franklin. So simple, so wise. An ounce of prevention is worth more than a pound of cure. So, specifically today, we're going to be talking about when you should discontinue oil use, how to remove any contaminated linens or clothing, to remove all excess oils off the mother, and to aerate the room if possible. Remember when we talked about at the beginning of the class the signs that delivery is imminent? You want to make sure that oils have been stopped long before that time. Oftentimes, moms will prepare the perineum by putting clary sage directly on there. When the baby is born, they're inhaling it into their lungs. It may be getting into their eyes. If the mom is doing a water birth and birthing underwater, those chemical constituents could be getting into the baby's lungs. You just really want to encourage the mom with the material that I've presented with you today and encourage her to discontinue the use of all essential oils long before the birth of the baby and explain why that's important. The baby is going through so many delicate physiological transitions, and essential oils are just very potent and really not advised unless you are. I personally, in my years of study, would not feel confident to recommend essential oils during the first few minutes of a child's birth. I have such a respect of the sacredness of that time, and just an awareness that I don't have the knowledge to know what to do. So while people are having, I feel like articles will come up on Facebook, they're using lavender for newborns in the NICU, and everybody's like, see, it's safe. It's like, well, gosh, not if that, I don't know. Just, I think that it's really important to impress upon the moms to get an agreement that there's going to be a discontinuation of oil use, and to really go through these steps and these protocols before you get to a critical space so that you're able to honor what's happening in the birth room, not do things in a way that is distracting from the incredible focus of the mom delivering her baby. And you just really want to make sure that you are proactive in thinking about when you're going to do this. Essential oils can be on linens or clothing and then come into contact with the baby's skin, which is incredibly sensitive. You want to be sure not to disturb the mom. If it's not possible to remove the linens, maybe adding additional linens will help. That sentence is incorrect. Sorry about that. We're just going to move on. Another thing that is important is that you remove excess oils off of the mother. You can do this by preparing the surface of a soft cloth with vegetable oil and gently wiping any exposed skin. You can do a little hand massage while you do this. Make sure that you really get in between her fingers. She's going to be touching the baby. So just take your cloth and just do each finger, kind of pull on them a little bit. Make sure that you get in between the fingers, then moving up the arm. And she might be more comfortable doing her chest and her neck herself. I also recommend that perhaps you give the mom a towel that has vegetable oil kind of not dripping, but on kind of all surfaces so that she can get, if she has done any essential oils like black pepper on the lower back or any essential oils on the perineum, while yeah, if she's done anything like that, it would be good for her to really get in all of those crevices. Especially black pepper can go down the gluteal cleft and be present there. That is a very stimulating essential oil that we do not want the baby breathing in at their birth. We also don't want repressive or relaxing essential oils to be inhaled as their first breath of air. And so make sure that that area is just totally cleansed. It might be best for the mom to do that herself. Next, you want to take the surface of another soft cloth and put tepid, not hot water and a very, very mild, just the slightest amount of soap, so slight that you don't even need to really rinse it off, and gently wipe all of the same skin that you just went over with the vegetable oil. Again, as you're kind of hearing me talk, you're getting a sense that you might need several cloths in your bag in order to do this. So I do recommend, if you know that the mom is going to be using essential oils, that you do bring the carrier vegetable oil in order to cleanse that, a mild soap if possible, in order to be fully prepared in order to help remove excess oils off the mother. Finally, be aware of any oils that are in her hair and either use a bobby pin to pin up those baby hairs or help her to um, just remove the oils. And back to Benjamin Franklin's quote, it's a lot better just to prevent uninformed oil use than to have to go through all of this. But I just want to give you these strategies so that you're thinking along these lines. Now, oftentimes a mom will give birth in a hospital room, and as you know, oftentimes the windows do not open and the doors have curtains across them. So make sure that you mention to the mom, if she is starting to put off a diffuser in that hospital room, that ventilating the room will be very difficult. Some doulas carry small fans that can be pointed towards the door in order to aerate a room. My one word of advice that's not written here, but remember when I talked about the transition from adrenaline to oxytocin production? That's something that you really want to facilitate through having the appropriate temperature. So make sure in your ventilation or aeration of the room that you are keeping an eye to the temperature to make sure that you are facilitating the best hormonal transition of the mother and newborn as possible. So, those are all of my recommendations. Common knowledge is not always common practice. So I hope that you don't go, yeah, yeah, yeah. I hope that you actually do these things. It will be a great service to the mothers and babies that you serve. So again, please discontinue all use of oils before the before the baby is born. Remove any contaminated linens or clothing. Remove excess oils and aerate the room when possible. That concludes our masterclass of transitioning oiled labor spaces to newborn safe birth spaces. And I just want to deeply thank you for your service in welcoming our newborns into a world that feels like love. Brilliant Birth Academy exists to support the people we think are doing some of the very most important work on the planet. So thank you for what you do. We honor you, and hopefully I'll see you soon.